Hello, everyone, and welcome to the session. This session will be about life sciences healthcare analytics, how AI is revolutionizing the space of life sciences healthcare. How are AI projects helping the patients, helping the doctors, helping the hospital administration staff, so on and so forth? How is AI helping pharma companies? How is AI helping different other medical equipment manufacturing companies, so on and so forth? We'll discuss more as we progress. So, even before we get started, that's me. Oops. My name is Bharani Kumar Depuru. I'm CEO and founder of two companies. One is AiSPRY, which is into AI services. Another is 360DigiTMG, which is into EdTech services. And I'm also chairman, artificial intelligence implementation for ITS India, Intelligent Transportation System. I work closely with Government of India. I have 20 years of experience and I work with different companies. If you're wondering on, hey, what is Infosys and Deloitte doing here? So let me tell you that if you go to Infosys Industries, for example, Infosys operates in the space of a lot of industries, and they also operate in the space of healthcare and life sciences. That means if you are a person who has experience in medical field, you would be hired by these kind of companies and you'll be working in these industries, healthcare, life sciences, etc. Deloitte, if you all are wondering, hey, you're saying that you have worked with Deloitte. How is Deloitte related to medical field? Sure, I can help you understand. So here you have life sciences, healthcare. Within that, you have healthcare and life sciences. A lot of customers in the space of life sciences and healthcare are customers or clients of Deloitte. They do a lot of AI projects for them. So that's the experience that I'm talking about. And I'm CEO and founder of two companies. One is AiSPRY, which is into AI services. Another is 360DigiTMG, which is into EdTech services. And I'm also a visiting faculty at Indian School of Business. And I'm also Chief Technology Officer at SteadfastUp. I and the founder, Dr. Ilan Kumaran, we have gotten into a pact, an agreement, right? And I'll also share that with you. Lakshmi, can you ping that in the link? Yeah. The MOU that we signed with SteadfastUp, please. Okay. And I also keep talking at different events like RICH, which is Research and Innovation Circle of Hyderabad. When they had AI in hospital administration track, I was invited and I spoke at length alongside a lot of other doctors. So if I were to show it here, a lot of people were there, a lot of chief medical information officer and doctors from different hospitals, heads of AIG, different other areas. They came in, and that's me. Yeah. If you're wondering on, hey, what is this guy doing there? This is exactly what I've been doing. Okay. And then Dr. Ilan Kumaran is the chairperson of the MedClave, or the medical aspects AI in healthcare of CII, Confederation of Indian Industries. And here is the MOU that we have signed with SteadfastUp. And this particular MOU means that we will take all the real world use cases of the AI projects that we are working on, and we will ensure that we give that particular knowledge to all the different stakeholders. Very recently at HISIA, which is Hyderabad Software Association, we won an award for a product called Garba, where we evaluate the quality of the embryo images, right? So these are all a few of the interesting things which are happening. So just to tell you all, jobs are available for people with medical background, healthcare, life sciences background in almost all the IT-based companies, because AI is all about data. Okay. Then we have data everywhere. We know that we have healthcare data, we have pharma data, we have life sciences data, we have administrative data, clinical, insurance, all this data is available. Okay. And then we have organ on a chip, chip in a pill, healthcare devices, so on and so forth. Everything is generating data. Let me give you one example of a project which we have done along with another company in Malaysia for Malaysian government. Okay. Say you are a patient who booked an appointment. Okay. The moment you visit the hospital, the conversation between the doctor, physician, and the patient would happen using Bluetooth. Using Bluetooth, the conversation between the doctor and patient would happen, and this conversation will be recorded digitally. Your name, name of the patient, age, gender, health conditions, what is the medication that is prescribed, all those details will get digitally recorded. Not just of one patient, of all the other patients. So what we have done is, over a period of time, once we collected a lot of data, we built prediction model which will predict what kind of diseases people might get. And these predictions were sent as an SMS alert or WhatsApp messages to the different patients. Prevention is better than cure, right? So this is exactly what we have done. Initially, patients, they did not believe that, hey, if you just send an SMS alert saying that, my dear patient, you will fall sick. You will fall sick in the next 1 week. And this could be the most probable reason or the disease. So better take precaution. When you send such messages, patients won't believe or trust. But when they visit the doctor, we started giving that doctor those prediction details also, which was sent to the patient. Then doctor would sensitize the patient. He will sensitize, right? He will tell that, my dear patient, you have received an SMS alert. You should have acted upon that, and you chose against it. So you fell sick. Then over a period of time, patient will build some trust on those kind of messages. Once the conversation is completed, patient can go and stand in front of the camera here, and it will detect using image recognition that it's you, patient A. Let me call this person as patient A. And then a bill is automatically generated along with the prescription form. You make the payment and move here. And here it will again recognize who the patient is and automatically dispense the medicines. I can show you that entire workflow also on how it has been implemented in the pharmacy. That is how AI is taking the life sciences and healthcare industry to the next level altogether. This is me, friends. That's me. I mean, it's not clear, but yeah. These are the kind of interesting, projects which you can accomplish. Then we are an AI services company called AiSPRY, and we have collaboration with Steta, and we together bring in a lot of interesting projects. We also, over a period of years, learned that there has to be a specific methodology to handle any project. And until and unless you know such things, you cannot differentiate yourself from the other people. A lot of people are reading over internet about what is AI, how AI is going to help life sciences, healthcare, vertical, etc. And that's all theory. When you talk with them, you'll understand after this training, okay? When you talk with them, you'll understand that they have only superficial knowledge, which everyone else has. but you will truly differentiate yourself from the other people because you'll be understanding the methodology as such. You'll be able to understand the business problem. You'll be able to understand how to collect the data, how to securely transport the data, because you'll have health information, right? Personal health information, PHI. So data is very, very precious. It has to be stored in a very secure manner. You collect the data, what kind of research you do, how do you pre-process the data, how do you build the models. And here we are going to train you on no code and low code concepts. What low code and no code concepts do is they will help you build AI algorithms, AI solutions without writing even a single line of code, or by writing only a few lines of code. Then how do you evaluate whether your AI solution is good or bad? Where do you deploy it? You cannot give that code to the end user and say, hey, start using. You need to give good user interface, a mobile application or a web application for people to access. And model that you build once will not be valid for lifetime. You have to continuously monitor to check whether the models are good or bad, right? Then we also make client visits to hospitals, to big pharma companies. Dr. Reddy's is our client. A lot of big hospitals are our clients. Because until and unless you visit, until and unless you talk with the doctors or healthcare professionals or pharmacists, you'll not be in a position to understand the business flow. Okay. And the first and foremost thing is you need to understand what data is available for your analysis. Where is that data stored? Without data, you cannot do any analytics. Simple. And the quality of the data is also equally important. You understand what are the various departments in a hospital, or in a administrative department, or within a pharmacy, or within medical equipment manufacturing companies. What are the various departments? What are requirements for them with respect to reports and dashboards? They might want to see a few reports on a daily basis, weekly, monthly, etc. This is the start of AI. AI does not mean building fancy things. AI starts here. And then you create a lot of interesting reports and dashboards. For example, how many vital drugs, how many essential drugs, how many desired drugs are sold across different specialties? That's a very basic thing, right? You should know what's happening within your hospital. How many patients are visiting every day to a specific specialty? You should know all those things, right? To be able to plan better. So this is the first thing which you have to know. Second is, this is an appreciation letter from the Senior Vice President of Biologically Limited. And why did they give that to us? Because of this. Once you are done with reports and dashboards, you then move into predictive zone, where you start predicting the future. For example, what we have done is, out of many forecasting models, we built a model which will forecast the raw material which would be needed for the next 1 week, 1 month, 1 quarter, 1 year, etc. You forecast and you place an order upfront. And you also calculate safety stock or reorder point, below which your raw material count should not fall. If the raw material count falls below this safety or reorder point, then your operations will stop. You'll not be able to manufacture vaccines or medicines. And only if you are able to forecast in a better manner, you will be able to save money on the inventory also. For example, we have done for Rela Hospital a project on, is Dr. Ilan here? No, I would have asked Dr. Ilan to throw more light about that. Okay, anyways, he'll be joining in a bit now, I believe. So for Rela Hospital, the project that we have done is pharmacy forecasting. What did we do as part of pharma forecasting? Oops. Okay. We have looked at how many vital drugs, desired drugs, and essential drugs would be needed across their 14 specialties. Liver specialty, so on and so forth. Because if you understock, then whenever a patient comes to you and asks for medicine, you'll always say, you know what, we don't have those medicines. If you understock. If you overstock, what will happen is, if you overstock, what would happen is, once the medicines reach the expiry, you will have to throw it. Or if it's closer to expiry, you return to the pharmacy or the pharmaceutical company, and they'll give you some money. The closer these medicines are to the expiry, less is the money that you get in return. So it's a loss. Hence, stocking appropriate drug count is very important. Okay. You can also reduce the bounce rate to 0%. Means whenever a patient comes and asks, you will always have medicines. The next thing is machinery. There are a lot of companies which manufacture medical devices, right? You use this in hospitals. And also, you have machines which manufacture medicines itself. You have medical devices which are manufactured. You also have medicines which are manufactured. In both cases, you'll have machines. In both cases, you have machinery. And it makes sense to collect the data from the machine. If the machine is getting heated beyond a point, it might fail. If the machine is vibrating a lot, it might fail. If it's giving you weird sound, it might fail. All these things might trigger a failure. Okay. Since all these things might trigger a failure, I believe, and we believe that we can build a prediction model, and we've done it. For one of the largest pharmaceutical company, we built a model which will predict whether this machine will fail or not. If it is going to fail, when will it fail? That is called as survival analytics. It's a term derived from medical literature. And which component might fail? These details, we have given it to the inventory management team, who will go and procure only the key components and keep it in their inventory. The next thing is medical devices. Medical devices captures a lot of data. But what do you do with that data? I recently visited Shenzhen, China, and we have gotten into a pact, an agreement with one of the companies where we will be taking the data from these machines and we will be predicting on what should be the next set of actions which doctors or nurses should take. And this is going to help save the lives of patients, right? So medical devices are not going to be dumb devices which will only capture the data. They will also predict on what might happen, and also it will give you prescription on what action doctors should take. Then we built a lot of projects in the space of video analytics. This is for Dr. Reddy's, where we get whenever vials and pre-filled syringes are manufactured, people were manually counting these. How many vials are there? How many pre-filled syringes are there? What we have done is, using image analytics, we automatically started counting the number of vials, number of pre-filled syringes, and we started saving that data in a database. From there on, any of the leadership team of Dr. Reddy's, they were given a provision to ask questions in English, Hindi, Tamil, Telugu, etc. You just ask a question. How many vials did I manufacture in the last 6 days? That language would get converted into English, English language to text, text to SQL query, and this query will fetch the data and show you the result within seconds. It's like a chat GPT application, right? So that is a classic example of generative AI. Then we also built a video analytics solution for clean rooms. Clean rooms should be really clean. the name itself says. And there's a lot of safety protocol which has to be followed. Like you need to have face shield, goggles, mask, gloves, coverall, etc. So if someone is not following that particular discipline or not abiding by the compliance norms, then there'll be a lot of issues, right? What we have done is we have stored all these details in the backend database, and we started generating compliance report. From that compliance report, you'll come to know who are the people who are following the process, who are the people who are not following the process. Finally, we built a solution in the space of embryo. So people who don't have kids go for assisted reproductive techniques such as IVF, in vitro fertilization. And then in vitro fertilization. So what we do is we take sperm from male, oocyte from female, and we fertilize it outside to form embryo. This embryo is then implanted into the woman's womb, and woman will then realize whether she's pregnant or not. If not pregnant, you will clean the womb and cycle 2 repeats. It's a very expensive affair, and it causes a lot of mental stress. So we have built a system where you need to take the microscopic images of embryo, day 3, day 4, day 5, upload it into our solution, which will then predict whether the embryo is of grade A or B or C quality. And if I just give a prediction that, you know what, your embryo is 90% probable that it's good or bad, right? Then people might not trust. Sorry. People might not trust it. So we built something called as explainability. That is, what portion of this embryo image is getting highlighted before it is classifying that it is bad, or before it classifies that it is good, what portion of embryo is getting actually highlighted. These are a few things that our solution helps you understand. Then everyone is talking about ChatGPT, generative AI, etc. We built a lot of GenAI solutions, and one is for StetUp itself, right? We trained the large language model like ChatGPT, but ChatGPT is trained on internet data. We have taken those large language models which are trained on medical literature, and then we fine-tuned it to suit the medical industry. And then you can create the discharge summary instead of typing, right? You can quickly get medical literature. If you are giving a treatment to a patient, you can get the treatment protocol to be followed. And this is also going to help the hospitals, because if we are going to fine-tune it on hospital process, then there is no question about your nurses or hospital administration staff forgetting the process. They can just issue a voice prompt, ask the question, and they'll get step-by-step process that has to be followed. In that way, many things. We built cancer prediction models by taking radiology, X-ray images. By taking pathology images, we have built, cancer prediction models, so on and so forth. So now, finally, after this, I'll be taking questions, right? This particular training program that we are launching is in collaboration with StetUp, which will be for 40 hours. In these 40 hours, 30 hours will be on core modules such as artificial intelligence, data science, machine learning, generative AI like ChatGPT, etc. For 30 hours, it will be on that. And another 10 hours will be recorded modules suiting your industry, your specialty. You just tell us, we will get all those use cases for you. Within a month, you'll be having access to your specialty. You might be from pharma, biotechnology background, dental background. You might be a general healthcare professional, right? You might be a general physician. or you might be a hospital administrator, or you might be a doctor specialized in IVF. Doesn't matter. You just let us know. We will get you 10 additional hours of super specialized modules, which will help you understand how AI solutions are built in your specialty. You'll also have 60 hours of assignments for your own practice. Until unless you practice, you cannot gain expertise. We will also give you an opportunity to work on one live project. Okay, it's up to you on how you want to work on that. And also, one thing, all the healthcare professionals who are joining this, you cannot ask a computer science graduate to just get trained on some medical course and start doing surgeries, right? On similar lines, we cannot expect healthcare professionals to just learn AI and become AI experts. However, you will have absolutely more knowledge than your peer group. If someone looks at both the resumes, one person doesn't know anything on AI, another person knows AI, they'll pick this profile. They'll get paid more salaries. From that standpoint, you'll have immense knowledge. And also, since we are going to resort to low code and no code, you will be having better control on the concepts. You'll be able to build, basic business problems. You'll be able to solve basic business problems using the skills that you learn. Also, you will get State University of New York certificate by taking the exam. State University of New York, USA is one of the largest universities of US, and you'll get data science certificate. There will be learning modules. You learn that, take an exam based on your convenience. And until now, no one has failed. So I'm hoping that you also won't fail. Yeah. And then to get into core depth, these are the various things that you will learn. Pharmaceutical forecasting, appointment scheduling. People will schedule an appointment and not show up. Who are those patients? Image classification models, right? You'll be able to look at object detection. You'll be able to build models in the space of generative AI. You'll be able to appreciate the CRISP-MLQ methodology. And you'll also be working on another module, which is agentic AI. You'll be able to design agentic AI to automate your workflows. Okay, to automate your workflows. You'll be able to do all these things and many more. So that's about this particular training module. There are a lot of other successfully accomplished projects in the space of life sciences healthcare, and all these will be introduced as part of the training. And these are all the research papers and research publications which we have done after the projects were completed. Dr. Reddy's, Rela Hospital, Biologically Limited, and many other clients we have from China as well. And these are the various awards and accolades that we have won over a period of time. Okay, so I'll stop here and take your questions. Thank you so much for being patient.